Good day everyone. Today we're going to assess the muscle strength. So first, what is the importance of assessing the muscle strength? Muscle strength is an essential part of physical exam used to evaluate the musculoskeletal and the nervous system, particularly the motor pathways responsible for voluntary movement. These pathways originate in the brain, travel through the spinal cord, and reach the muscle via peripheral nerves to produce movement. It is performed by asking the patient to move against resistance, and is graded on a scale of 0 to 5, where 0 indicates no contraction, and 5 indicates normal strength. This assessment helps detect muscle weakness, paralysis, and neurologic deficit, affecting the brain, spinal cord, peripheral nerves, and muscle.
Hello everyone, today we are going to assess the muscle strength, grade 0 to 5.
Identify the patient. It confirms patient identity using standard safety protocols before any procedure. Explain the purpose of the procedure and answer any questions. This obtains informed consent and prepares the patient for participation. Perform hand hygiene. Position the client comfortably. Assess upper extremities. Shoulder abduction. It assesses the strength of the deltoid muscle and shoulder joint function. Elbow flexion. This evaluates the strength of the biceps muscle responsible for bending the elbow. Elbow extension. Tests the strength of the triceps muscle responsible for straightening the arm. Test bilaterally. Wrist extension. This assesses the function of the wrist extensor muscles and related nerves. Hand grip. This measures overall hand muscle strength and bilateral symmetry. Finger abduction. It evaluates interossei muscle strength and ulnar nerve function. Hip abduction. This assesses the strength of the gluteus medius muscle for lateral leg movement. Assessing thigh strength. This evaluates the strength of the hip flexor muscles for lifting the thigh. Thigh adduction. Thigh adduction. This tests the strength of the adductor muscles that bring the legs together. Knee extension. This assesses quadriceps muscle strength for straightening the knee. Knee flexion. This evaluates hamstring muscle strength for bending the knee. Ankle dorsiflexion. This tests anterior lower leg muscles important for lifting the foot during walking. Ankle plantar flexion. This assesses calf muscle strength used for pushing the foot downward. Assess the patient to a comfortable position to prevent discomfort or injury. Perform hand hygiene to reduce the risk of cross-contamination. Document the findings to ensure accurate recording for evaluation and continuity of care.
Scale for grading muscle strength. 0 for no muscular contraction detected, 1 for barely detectable flicker or trace of contraction, 2 for an active movement of the body part with gravity eliminated, 3 for an active movement against gravity, 4 for an active movement against gravity and some resistance, and 5 for an active movement against full resistance without evident fatigue. This is normal muscle strength. Abnormal findings: full range of motion, symmetric strength, holds position against resistance with a grade 5 out of 5 must be present. And for the abnormal findings, weakness or asymmetry, limited range of motion, rating of 0/5 with no contraction, 4 out of 5, or weakness resistance indicates potential neurologic or musculoskeletal issues in
So, assessing muscle strength helps identify muscles weakness or imbalance, diagnose neuromuscular disorders, monitor disease, progression or treatment effectiveness, guide rehabilitation or physical therapy plans, and detect potential injury risk or functional limitations. So in short, it gives clues about the patient's motor function and overall physical